Now, I'm from Australia. I know there's one other Aussie here today, so that's reassuring, comforting hearing that accent. It is common practice in Australia when we have a talk, when we have a gathering, that we acknowledge the traditional custodians of the land. Many people incorrectly assume that Australia is one of the youngest countries in the world. White Australia is young, it's about 200 years old, but in fact the Indigenous people of Australia is one of the oldest continuing cultures in the world. So I just like to acknowledge the Gadigal and Bidjigal people, the lands on which I work. That's my university, the University of New South Wales, and also just to acknowledge one of my colleagues, Dr. Grace McEwen, who's doing some fantastic work around physical activity programs, mental health with First Nations communities. Unsurprisingly, finding that when we include culture, we get better outcomes. So what are we going to cover today? We're going to talk a little bit about the Olympic Refuge Foundation, the Olympic Refugee team. Did anyone see the Olympic Refugee team a few weeks ago? Yep, a couple of people, good. We'll talk about that. We'll talk about the triple nexus. So this is this interesting concept of thinking about the intersection of humanitarian outcomes, development outcomes, and peace. We'll talk about rock climbing in Lebanon, football in Uganda, building physical activity and mental health workforce capacity in Ukraine and affected countries. And then we'll finish up with Bangladesh and some of the work in the south of Bangladesh, working with the displaced Rohingya. This is one of the biggest protracted humanitarian crises in the world. And then in the northern part of the country, we now have climate refugees. So there's an enormous issue there. Okay, so to start, we published this piece in 2022 in BMJ Global Health, and this was on behalf of the Olympic Refuge Foundation think tank. And we called this Realising the Cross-Cutting Potential of Sport in Situations of Forced Displacement. Now, this was only 2022. You can see the first sentence, if you can see from there, it says globally over 80 million people currently live in a context of forced displacement. If we fast forward to today, it's not so many years later, we're now over 100 million people. So this is the highest amount of forcibly displaced people that we have in our history. And I can send all these slides, so don't worry about QR codes or anything like that. What we tried to outline here is an argument or rationale about how much of the research that you're going to hear from some of the amazing presenters today can be translated and applied even in contexts of forced displacement. And it's a bit of a difficult thing to get your head around, because you might be thinking, look, there's people that don't have basic needs met. Why are we talking about sport and physical activity? Surely when people need food, when people need security, there's other things to worry about. But hopefully I'll show you a bit of a rationale as to why that's not the case. So that final athlete there, Cindy Ngamba. Cindy Ngamba won the first medal for the Refugee Olympic team, so a bronze medal in the women's boxing. And that campaign, called 1 in 100 Million, was released by the Olympic Refuge Foundation with the idea of promoting this idea of 1 in 100 million, that these athletes can achieve amazing inspirational things. And that's exactly what happened with Cindy Ngamba's medal, which was an amazing outcome. There's been a few more medals for the Olympic team in the Paralympics just recently as well. Now, the Olympic Refuge Foundation is set up, there's two parts to what they do. One part is looking after the Refugee Olympic team, so people like Cindy. And the other part is what they do is programming in places around the world that are affected by forced displacement. So they have programs all around the world, in Bangladesh, in Colombia, in Turkey, in Uganda. And it's that part of the work that I'm most involved with in terms of thinking about how do we implement sport in these sorts of contexts. And I've got another really brief film here that I'll play.
team like no other. A team that's creating change across the board. Leaders, businesses, coaches, athletes, displaced young people, united by the Olympic Refugee Foundation and one goal: to rebuild young life through sport. Because when life is in need and nevertheless finding refuge means everything.
Tunasahau kama tuko wa refugee juu tukicheza tunasikia furaha nyingi, yuko sasa tuko nje tu.
On this team, we hone our talents. We build skills that last forever. We dream of what we can achieve. We belong.
Çok mutluyum. Burada arkadaşlarımla eğleniyorum.
Powered by the Olympic spirit, everyone can play a part to make sure no young person is left out, so we can feel at home again, thrive again, and shape our own futures. That's why this is a team like no other.
So it's hard not to be inspired by that footage, at least I find it hard not to be. There's some amazing work that they're doing. So the mission of the Olympic Refuge Foundation, shaping a movement to ensure young people affected by displacement thrive through safe sport. And I'm going to talk more about that idea of safe sport as we go along today. Sport has the power to have the most incredible impact on young lives. We are uniting leaders, businesses, coaches, young refugees from across the world to create a team with purpose, a team like no other. We all share one goal for displaced young people: to find belonging through sport and shape their own futures their way. Now, as I said, in addition to the refugee team, there's the programs. And I've been very fortunate for the past couple of years to, I was the inaugural co-chair of a think tank through the Olympic Refuge Foundation thinking about sport and mental health in humanitarian contexts. So they did a great job bringing together academics, practitioners, people with lived experience of displacement, which was absolutely critical, all together to talk about this concept about how can we translate some of the evidence we have that we're going to hear more about today into real-world programs on the ground. And it's sort of an interesting mix of different fields where we think about the sport for development sector that have been doing this work for a long time. We then have mental health professionals in these situations or in these contexts who are often promoting sport and physical activity without any training or awareness of sport for development or physical activity. And then we have physical therapists doing work. So there's this whole hot pot of different people with the same aim, and they're doing the same work, which is actually trying to encourage movement and physical activity. So this is where it gets interesting at the moment in sort of humanitarian development work, and it's something called the triple nexus. And the triple nexus is interested in how do we think about programs that consider humanitarian outcomes, so immediately following a crisis, development outcomes, so the long-term impact of that crisis, and also peace, so things like social cohesion. When we think about sport and physical activity, there's an enormous opportunity to have an impact on things like social cohesion. If we think about refugee communities, there's often a big impact on the host communities as well. About 80% of all people that are forcibly displaced are in countries, low middle income countries. So there's a big impact on not only the refugee community, but also on the host community as well. And I'm going to talk more about this picture as we go, and this is taken from the Rohingya refugee camps. So these are one of the biggest camps in the world. And I took this in 2020. This is a game called Chinlon, which is common in South Asia. It's like volleyball, but it's played with this little cane ball and only with your feet. So if you're someone like me that has two left feet, it's pretty incredible to actually watch what these guys can do. But one of the really interesting things, and I'll talk about this more, is if you look at that picture, what can't you see in that picture? What's missing?
Adults.
What was that?
Adults.
Adults? There are a few, but that's not a bad answer. What else? Yeah, possibly. So that social part. What else? There's something a bit more simple. Shoes, yeah. So lack of resources, it's very common. What else? What can't we see? Supervision, yeah. It's not. What I'm looking for there is women. I can see James and Michelle nodding. Women, girls. Now, one of the biggest issues we've had is when we think about sport in situations like this, the immediate response or the immediate thing that people think about is young men, able-bodied young men. Let's set up a football tournament for the best of the best that are there. And in fact, we're missing a key opportunity, and we're going to hear much more about this from Michelle. Women, girls, people living with a disability, these are actually the people who stand to benefit the most from these interventions. But these are the people that are systematically excluded because we're just not delivering or designing interventions catering to the needs of those people. So that's been a big focus of my work, thinking about how do we engage women, how do we engage girls in these sorts of interventions.
أمرار بحس حالي زعلان وزهقان، ما بحس حالي متحمس أعمل أي شيء، بس فكر بالمستقبل بحس بالخوف وبعتل الهم. كل اللي بعمله إني قاعد بالبيت. بدي أغير هيدا الشعور بس ما بعرف كيف.
في كتير أشياء بتصير نحن ما فينا نسيطر عليها، وهذا شي عادي. اتذكر في أشياء تانية فينا نسيطر عليها.
شو هالأشياء؟
إنه نضل بنشاط وحركة، بس كون نشيطة، بحس حالي قوية، عندي طاقة أكتر لأعمل أشياء أكتر كل يوم، بحس إني مبسوطة أكتر. بس كون زعلانة أو مالي خلق على أي شي، بحب كون نشيطة. هذا الشي بيخليني أكتر مبسوطة ومرتاحة مع حالي. أنا بحس بصحة أفضل بس أعمل تمارين، عم بعمل جسمي أقوى كرمال أقدر حارب أكتر الأمراض.
بس أنا ما عندي الطاقة لأتحرك، ما بحس حالي فيني أعمل رياضة.
أمرار بداية التمارين الرياضية هو شي صعب، ولكن مجرد إنك تبلش رح تحس حالك أفضل. كل ما كنت نشيط كل ما كان عندك طاقة أكتر. التمارين الرياضية هي لكل شخص فينا، إن كان صبي أو بنت، كبير أو صغير. النشاطات الجسدية بتساعد على تخفيف الضغوطات بجسمك، هذا بيعملك مبسوط أكتر رياحة وصحة أفضل. كل شخص بالعالم في يعمل تمارين، ما بيهم مين بيكون أو وين بعيش، لازم بس تلاقي التمرين أو النشاط اللي بيخليك مبسوط.
ቤቴ ሆኜ የአካል ብቃት እንቅስቃሴ ማድረግ እወዳለሁ። በየቀኑ ተነስቼ ፑሽ አፕ፣ ሲት አፕ እና ቁጭ ብድግ እሰራለሁ። የመጀመሪያ ጊዜ ፑሽ አፕ እንቅስቃሴ ለመስራት ስሞክር ለ5 ጊዜ ብቻ ነበር። ከ2 ሳምንታት በኋላ 10 ፑሽ አፕ መስራት ቻልኩ። አሁን በየቀኑ 20 ፑሽ አፕ መስራት ችያለሁ። ብዙ የአካል ብቃት እንቅስቃሴ በሰራው ቁጥር ጠንካራ የሆንኩ ነው።
بحب امشي واتنشط لاني كبيرة بالعمر، عندي تسنجات، ظهري بيوجعني. لما نشط جسمي عقلي وجسمي بيرتاحوا، احلى من القعدة طول النهار.
أنا بحمل أشياء ثقيلة بسبب شغلي، وهذا الشيء بيعطيني لياقة جسدية وبيخليني أقوى كمان، وهي القوة بتخليني أتسلق أقوى ولوقت أطول كمان.
الشباب والصبايا لازم يمارسوا الرياضة أقل شي 150 دقيقة بالأسبوع، ونحن كأولاد لازم نلعب أقل شي 60 دقيقة كل يوم. في كتير نشاطات فينا نعملها.
هيدا شي كتير حلو، بس بلكي أذت حالي.
بس تجرب تمرين، ما تنسى تبلش بشكل بطيء كرمال تتأكد إنك عم تعمل حركات مظبوطين. رفقاتك فيهم يساعدوك، ما لازم تكون بطريقة بتأذيك. أمرار التمارين بتكون بدها تحدي أو صعب شوي، هذا بيساعد جسمك وبيعمل عقلك أقوى.
كتير حلو، أنا جاهز بلش تمرين جديد.
واو، شوف أنت تسلقت شي صعب هلأ، أنت كتير قوي.
شكرا كتير، بس كون نشيط بحس حالي أقل توتر، نام بشكل أفضل بالليل، حاسس حالي بصحة أفضل. وقادر أتغلب أكتر على الصعوبات. هلأ صرت متفائل ومتحمس أكتر لأعمل أشياء أكتر.
Okay, you might be a bit confused, going, why is there a cartoon about a climbing wall in a refugee camp in Lebanon? It's a bit of a strange thing to come together. So this is part of the work that we've done in different contexts, thinking about how do we translate, again, some of this knowledge into the communities who need it. And what's the best way of doing that? So we've teamed up with this charity, Books Unbound, and produced some of those animations, not only in Arabic, but also in Rohingya, targeting the Rohingya community. And you'll very deliberately see that the main character there was a woman, and that's the case with all of the cartoons that we're doing, trying to challenge some of the notions, again, that physical activity and sport is just for men. Now, that cartoon is not just based on a good story, it is based on science and some data. And I'm very excited that we have a trial that's just been accepted in conflict and health, led by Katharina Luttenberger from Germany, evaluating the impact of that climbing wall and that climbing program. And that was run by a charity called Climate, which is based in Switzerland. It's an incredible story. The founder, Beat, literally drove a mobile climbing wall on the side of a truck into the Bekaa Valley in Lebanon, which is a refugee camp, refugee context. There's an enormous amount of refugees from Syria, from Palestine, living in the Bekaa Valley. Beat drove the truck in, and he's been there now for over 5 years, providing what he calls a psychosocial informed bouldering intervention. And together with Katharina, we were able to evaluate that climbing wall and look at the outcomes through a waitlist randomised trial. I'm not going to present the data. I'm going to leave that to Katharina because it is very fresh and it's entirely up to her to share, but just to say that the results were absolutely positive. And this is adding to the weight of the evidence that we have around these interventions. You know, some of the interesting qualitative feedback as well was how men perceived women following the climbing trial. We heard some fantastic stories, and you could see in the video, we tried to depict one of these, that climbing is not a particularly gendered sport. Just because you're a man doesn't mean that you're necessarily going to be a better climber. And so we had it was an opportunity where men and women could actually climb together if they were able to, and that men could see, and we got some interesting feedback saying, wow, I didn't know women could be so strong. So that was really a really interesting outcome, exactly what we were trying to achieve. Okay, I'm going to take a little bit of a sidestep now and talk more broadly about humanitarian mental health care, just to give you a bit of context about how this work all fits in. So for those that aren't aware, when we think about humanitarian mental health care or emergencies, it's split based on this acronym, Mental Health and Psychosocial Support, or MHPSS. And all of mental health programming in these contexts revolves around this pyramid, or the 4 layers of the MHPSS pyramid. Up at the top, layer 4, you've got specialised services. Now, in places like the Rohingya refugee camps, there's a severe lack of psychiatrists. When I was working in camp, we had about 1 psychiatrist once a week. What that means is that a lot of people living with serious mental illness, people living with psychosis, for example, are often chained, and they're also often restrained and restricted because it's the only way that their family and their friends can actually manage them, because they don't have access to medication or treatment in the same way that we do. So that's layer 4, specialised services. Then we move down to what's called focus supports. So these are often not necessarily provided by mental health professionals, but they are targeted, non-specialised support. Layer 2, community and family support. So it's about how do we build connection and how do we build on the existing resources that people have. Layer 1, basic services and security. Now, the whole time I was working with the UN and when I was engaged with this work, when we talked about sport, the initial response was that's a layer 2 intervention. Always layer 2. And there was never consideration that actually we might be able to implement physical activity at every layer of this pyramid based on the evidence we have. And so what we've done is a lot of work trying to articulate to that community how we can actually consider physical activity and sport at every layer of that pyramid. And there's lessons here, I think, for all of us in all countries, not necessarily just those working in humanitarian settings. So again, layer one, we've got social considerations, basic services and security. What we would argue from a physical activity perspective is that we need to ensure that everyone has access to safe, socio-culturally appropriate physical activity resources and environments. I'll give you an example. Manchester United, they often fly into refugee camps, hand out a bunch of balls, hand out a bunch of soccer boots, and they leave. That's fine. That's not a problem. That's great. They're doing that, but we'd say that's level one. Yeah, that's about providing access to the resources people need. That's the very basic thing we need to be considering. And the same goes for a hospital in Australia. We talk about trying to improve access, patients to physical activity. Well, the very first thing we need is access to resources. Layer two, strengthen and foster participation in community-based physical activity opportunities. So how can we think about what's available in the community and making that safer, more appropriate for people that we may be working with, people that may be experiencing displacement, that may be experiencing mental illness. An example there, I don't know, I'm sure here you have parkrun on the weekends. Is that a thing here? No? Maybe, yeah, parkrun. Is parkrun necessarily going to be appropriate for everyone? Maybe people living with schizophrenia or PTSD, maybe not. But are there things that we can do to help people utilise parkrun? Can we train potentially the parkrun instructors or the people that are there to help make that more appropriate, more accessible? So that's strengthening community family support. Layer three, focus non-specialised. So here, how can we develop targeted programs that are deliberately targeting mental health outcomes? So I would argue that ClimeAid, where they employed mental health trained professionals and sports coaches who had a mutual understanding physical activity and mental health to provide a program they were deliberately targeting mental health outcomes. We would say that would be at layer three. And then finally, if you think about referral schemes inside hospitals, inside clinical mental health services, how do we have physical activity specialists? So kinesiologists, physiotherapists, university-trained practitioners who can provide that one-on-one support that might be needed. So again, what we would argue is that everyone should be getting access to some sort of physical activity support based on the evidence we have. We just need to match the resources that that person needs in order to be able to participate. Okay, now I'm not an evangelical saying exercise is going to cure everyone, because it absolutely won't. And there's a really important question here about can sport cause harm? And the answer is absolutely yes. And I'll tell you a little story from northern Uganda. This was a great piece of work led by a friend and colleague, Dr. Justin Richards, who currently lives in New Zealand. He's originally an Aussie. And this was his PhD work in northern Uganda, which was a post-conflict setting at the time, in Gulu. Now, all of these young men that you can see were former child soldiers that were caught up in the war in Uganda. So they'd been exposed to a significant amount of trauma, and Justin was there evaluating a football program. So he wasn't designing the program, he was just there doing the evaluation, and he managed to do a quite incredible randomised control trial in what was a very, very difficult context. Now, what they did was they set up this football tournament. They had these young men. Of course, they needed coaches. So they asked local volunteers to volunteer as coaches. Yeah. Now, these local men had no training in coaching. They had no training in trauma-informed practices. They had no training in basic mental health skills. What they did know was what they'd seen on the English Premier League, which is coaches walking up and down the sideline screaming at the players. So that's exactly what they did. They thought they were being good coaches. Now, you can probably imagine what happened to the players. So you've got former child soldiers exposed to significant trauma. They're now playing in a highly competitive tournament. They've got a coach walking up and down the sideline screaming at them. And when Justin looked at the main outcome here of psychological distress, it got worse for those participants. It's not really a surprise. When we sort of think about it, it makes a whole lot of sense. So the quality of that supervision, the quality of the physical activity environment is absolutely critical. We can't just give people a ball and say we're providing a mental health intervention. That's not the case. And this is absolutely where we need partnership between the mental health professionals and the sport physical activity professionals to bring this together. Now, we often think about the FIT principle with exercise, frequency, intensity, time, type. There's a few other factors that we can consider as well. And this was a piece led by my colleague, Stuart Vella, on behalf of Sports Medicine Australia and the Australasian Society. And what Stu identified here was what he's called the contextual factors of physical activity. So beyond that FIT principle, frequency, intensity, time, type, thinking about what you're doing, when and why you're doing it, where you're doing it. For example, we talk about the green gym and the blue gym, exercise outdoors, exercise around water. Who you do it with, so the social environment we know is absolutely critical. Some people will need one-on-one support, some people want a group, some people will want both. We need to provide options to meet the needs of the people. And finally, as we saw in Justin's work in Uganda, how it is delivered. The quality of that supervision is absolutely critical. So this brings me to some work that we're doing with the Olympic Refuge Foundation about bringing these workforces together, thinking about the mental health workforce, thinking about the physical activity or physical health workforce. And what we've been looking at is two sides of the same coin. One, what training do mental health professionals need in order to understand physical activity, in order to understand basic principles of exercise prescription? And on the other side, what do our physical health professionals need? For example, coaches. And this work is focused on the Ukraine response, so about 11 countries surrounding Ukraine. How do we bring those professionals together and train them in foundational mental health skills? So things like psychological first aid, mental health first aid, but adapted for that sport environment. We ran some pilots in Paris, in Moldova, in Poland, and there's now a fantastic partnership between the Olympic Refuge Foundation and the International Federation for the Red Cross Psychosocial Centre with a program called Sports Coach Plus. And the aim is to reach 100,000 young people through safe sport. So these are coaches that are trained in foundational mental health skills. And this is a program, again, led by Leslie Snyder, adapting from psychological first aid. For those that are interested, there's a podcast released by the Olympic Refuge Foundation called Think Sport, Think Refuge. There's 4 episodes. One of those episodes is Leslie talking exactly about this program. So these are the pilots we ran. One of the most interesting ones was in Poland. And this was only in March 2023, so shortly after the war had started. And we brought together one mental health professional and one coach or physical education teacher from every region in Poland to attend a 1-week training, with the idea being that after that training they could go back to their regions together and run trainings together, provide mutual supervision to each other, mutual support, to build that workforce capacity between the coaches, the physical education teachers, and the mental health professionals. So this might be familiar to a lot of people in the room. And this was the Bangkok Declaration 2016, led by the International Society for Physical Activity and Health. And what this looked at was the Sustainable Development Goals, the UN SDGs, and how many of those SDGs could actually be impacted by physical activity and sport. So obviously the centre, ensure healthy lives and promote well-being, of course, that's a given. Quality education. We may not often think about education being linked to sport and physical activity. We think about a refugee camp, getting kids to turn up or having opportunities for education is a bit difficult. If you have opportunities for kids to come and kick a ball and play with that ball, they absolutely will come. So there's an opportunity of getting people into education through physical activity. Gender equity is an absolutely crucial one. I don't need to talk about that. I'll leave that for Michelle. Reduce inequalities is also critical. And hopefully we've touched on that a little bit today about how we can use physical activity for inequities. Inclusive, safe, resilient, sustainable cities and communities. Just, peaceful and inclusive societies. Again, that impact on social cohesion. Here's another example of something that people may not have considered, and we're doing a lot of work with a PhD student from Pakistan, looking at the role of physical activity in preventing violent extremism. And again, it's not just saying that exercise can save the world from everything, but if we think about it logically, if we can provide an alternative for young people through sport, provide an opportunity for good quality mentorship through coaching, there's actually an opportunity to think about the impact that we might have on things like violent extremism. Now, one of the reasons that first took me to Bangladesh in 2019, so I finished my PhD in PTSD and exercise in around 2015, so I was very interested in trauma and exercise, but most of my work had been with military veterans and emergency service workers. Then in 2017, I ended up in Turkey working with a psychosocial organisation close to the border with Syria in Gaziantep. And I was there, that's an urban refugee context. We were there talking about sport and physical activity with these psychologists, and they were very interested. It was a really useful time for both of us. But then I got thinking about, well, if it's working in this urban environment, what's probably one of the worst places that I can imagine on Earth at that point in time? And this was in 2017, and this was a few months after the peak of the crisis in Bangladesh. So there was about 1 million Rohingya refugees that had fled Myanmar across the river into southern Bangladesh. And one of the things that I was really interested in was this idea of adverse childhood events and the impact on mental illness. And there's two great reports, one in JAMA Paediatrics and this report from Public Health Wales, showing really interesting data that participation in physical activity and sport may prevent future mental illness in adults. So I then ended up in Bangladesh. I was able to visit the camp and see for myself. I was often thinking about why this was a bad idea. When I was first driving through camp, I thought this is a little bit crazy. But the first time I drove through, it was pouring rain. There were kids in knee-deep mud with plastic bags wrapped around each other to form a soccer ball, and that's what they were playing soccer with. So driving through camp, everything that I could see when you looked for it, physical activity, movement, sport was a part of what was happening, even without any resources to do that. So this is Bangladesh. It's a small country by land size in southern Asia. There's about 200 million people. It's one of the most densely populated countries in the world. Dhaka is the capital. And the two things that I'll talk about today is one, Cox's Bazar, which is down here in the south, right on the border with Myanmar, one of the poorest regions of Bangladesh, now host to one of the biggest refugee crises in the world. And I'll also talk about a place up here in the north, in Saidpur, which is now, again, one of the poorest regions in already a very poor country, significantly affected by climate change and climate displacement. So we'll start with the Rohingya, and the Rohingya Muslims are recognised by the UN as one of the most persecuted groups in the world. They don't have citizenship, so they're stateless, which for me, the first time I actually engaged or met someone that was stateless, trying to understand and get my head around what that actually means, to not have a home, not have a belonging, not have a passport, not have an identity, and the impact that has. Again, there's been Rohingya refugees in Bangladesh since 1991, but the peak of the crisis was in 2017. This photo I took from Cox's Bazar in Teknaf, and you can see Myanmar, Rakhine State across the border. So at the peak of the crisis, people were sitting here watching the smoke coming out of here and the villages being razed and people coming across the river. That's what the camp looks like in 2018. It doesn't look much better today. It's pretty much the same. There's issues around the Bangladeshi government not wanting the Rohingya to be there permanently, so they're not allowed to build permanent structures. This is like a city. There's 1 million people, and when you stand there looking out of the horizon, you can just see tents like this as far as the eye can see. So it's a pretty incredible place. That's what the camp looks like in 2018. Again, not much different today. It is severely impacted by weather. At the moment, there are currently floods. There are cyclones every year. There's huge issues that happen in that camp. I'm going to play you a little bit of sound here from one of our colleagues, Habib. Let's see if I can get this working. No, I wonder if there's a little speaker button just here on the top right, if we can click that. Sorry. So this is Habib, who was one of our translators. It's not a picture of Habib, and he took us through the camp and helped us do some of the formal qualitative work that we did in camp. And I just want to, if you can, hear Habib's voice.
Suppose I feel sad. My situation is not good. I am not feeling well. That times I feel tension because I have left Myanmar and I don't have a home here. I am in a hut, in a tent, and I don't have any hope. I don't see any future. Yeah. That time I may feel tension. I may feel sad. And if I just play a game, then my tension relief, remove. That's the tension.
Yeah. It was interesting to hear yesterday when we spoke to the boys about sport and why they play. That was the first thing they said.
Tension.
Was tension.
Yes, that tension means for 95% of the refugees have tension because they don't have home. They don't see their future.
So sorry, some of the translations cut off. Tension, this common idiom of distress, and we hear that in a lot of communities around the world. What we might describe as PTSD, anxiety, depression, a lot of communities describe as tension. Now, of course, if you're living in that environment, if you are stuck, if you don't have employment, if you don't have access to education, if your children are not safe, of course, you're going to be experiencing distress and tension. When we went to do this work, I should just clarify, they didn't know what we were interested in. So we didn't tell them we're here to talk about sport and mental health. So it was really, interesting, and it was experiences like this, experiences like seeing the kids with the plastic bag tied up as a soccer ball, that allowed me to wrestle with that sort of issue about, is this really a priority or not? And I'm constantly in that sort of discussion, but there's often always coming across things like this that reiterate or reinforce to me that we're on the right track and this is useful to explore. Now, I'll just point out this soccer game. So this is inside the camp. There were thousands of people that came to watch this game. Again, the way sport can be more than just the people that are participating. It's about who else can come and be involved. If we think about other public health interventions like vaccinations, for example, there's very few things in camp that will bring people together like a sporting match that allow you to then potentially deliver other sorts of interventions. And some of those other goals, those other sustainable development goals. Enormous potential and power of sport, again at the moment, typically just men. So we then returned to Bangladesh and did some formal research, some qualitative research to understand what the community's views around physical activity were. Interestingly, one of the stories we heard from the women in camp was that they would wake up before the men were awake, and obviously gender-based violence is a huge issue inside the camp. The women would wake up in the mornings before the men are awake and they would go on a walk together. And when we asked them, well, why do you do this? They said tension. So again, this idea that this is a community-identified strategy, that even if they don't deliberately recognise why, they're turning to sport and movement as a way of managing, as a way of dealing with that stress. At the same time that we were doing the work, Salek, who became my colleague and very dear friend, was also doing work. He is a Bangladeshi psychologist. He was also doing work at the same time, thinking about sport, physical activity, and adolescence in the camp. The joy part for me is absolutely critical. It's about joy. It's about momentary relief. We're not trying to increase fitness necessarily, although NCDs, cardiovascular disease, is rapidly rising. It's becoming a huge issue in these sorts of settings. But it is about joy. It's about having that moment of escape. Now, this was only a few months ago in May, and this is up in the northern part of the country, in Kurigram. And I was very lucky to visit a program there called Spirit, which is run by Terres des Hommes, a humanitarian agency. And SPIRIT stands for Sport for Protection, Resilience and Transformation. And again, just that word protection, so in humanitarian settings, that's really talking about protecting people from harm, children's rights, women's rights, GBV. You often have sports programs that are run by the protection teams. So UNHCR, the UN Agency for Refugees, they have a whole Sport for Protection program. The mental health staff aren't involved. This is where there's these sort of silos that just based on who's sitting where in Geneva as opposed to the actual evidence. So this community in Kurigram, this river that you can see just here, every few months that floods and they get displaced, these communities. What was so exciting for me about this program is that it was targeting women. This was a women's handball game, and even despite the environment and the settings that they're living in, this is a permanent court that the community has built until it floods. And when I went and visited this game, immediately I saw there was a father in the background digging a hole. He was doing some manual work, and I immediately went to him with a translator because I wanted to understand what his views were. Culturally, this is quite a conservative culture, and there's issues around women in certain places. There's issues around women participating in sport, particularly publicly. I had this great chat with the father, and I asked him, how does he feel about his daughter playing? And he gave me this smile and just said, if she's happy, it makes my life easier. So he was very happy for her to participate. It's a big credit, though, to Terres des Hommes and the Olympic Refuge Foundation, because the amount of work they did with the community before they set this program up was absolutely critical. They set up a fathers advisory group, and they consulted them first. They then consulted the mothers. They then worked out how the community wanted this to work and explained why. They really took their time, and it shows, the impact shows. And the smiles on these girls' faces was absolutely incredible, just watching them being able to play. For me, the gap here, again, as I was watching this game, there were a group of mothers sitting behind me. Child marriage is a big issue in Bangladesh, so a lot of these mothers were very, very young. We would still consider them children here in the US. And I was interested in asking them, do they want to participate? And their eyes nearly bulged out of their head because it was just such a foreign concept. But of course they wanted to, they want the opportunity. And we're currently doing some work with a university in Bangladesh to do some qualitative work with those mothers to work out what might be possible and how we might be able to set programs up for them that also respect culture and context and are done in a way that is sensitive and safe. Now, a lot of the work that I've done in Bangladesh is thinking about how do we train the mental health professionals. And we spend a lot of time synthesising all the evidence we have into these 5 key messages. And a lot of my colleagues who are doing real science find this quite amusing, that I spend most of my time drawing cartoons with colleagues, but this is the work that I've ended up doing. So these 5 key messages is what we use for the training, and these posters you can see, again, made by Sophie from Books Unbound, are very much focusing on the culture, the context, in English, in Bangla, and also in Rohingya, which isn't a written language, so it's a bit difficult. It's been quite a process. I'll explain what these messages are because, again, they're relevant, I think, beyond this situation. So 1, moving our body can help relieve tension. These posters are also being put up by UNHCR in the health centres, in the health clinics around the camp. 2, physical activities for everyone. It's not just fit, able-bodied young men. 3, physical activity can help us connect with our community. Finding a type of physical activity we enjoy can help us feel good in our bodies and minds. And finally, I can move my body. Again, that one's very much focused on older adults and often countering this idea that if we experience pain, that we shouldn't be moving at all. So we've used these messages in order to train the mental health staff. I mentioned SALEC before. That's SALEC. This is the UNHCR mental health team. They've been incredibly supportive in giving us opportunity to work with their staff and work with the mental health working group across Bangladesh. We did do a very brief evaluation, looking at the outcomes of that training program. Asking practitioners questions such as, I have good knowledge of the physical activity guidelines. People I support are not interested in physical activity. Really interesting things came up here, like, for example, prayer. How we can use prayer as a way of promoting activity. And that's been something that people like Salek have been working with the community, with the imams, with the spiritual leaders to understand how we can incorporate that. This is the final slide that I'll talk on now. One of the key things for me going forward with this work is thinking about research capacity in conflict-affected areas and low-income contexts. Now, what we often don't realise in Australia, in the US, is how many barriers there are for people living in countries like this to actually do research themselves. So I spend a lot of time at Dhaka University and also universities in Colombia working with research students and trying to support them to do their own research. Things that we take for granted, like accessing journal articles. Universities there don't have subscriptions, so they're already excluded. 2, language barriers. English is not their first language. People are scared, they're embarrassed, they don't want to contribute. And if we think at every level from peer review all the way through, how systematically excluded people from countries like this are from actually participating. It's very easy for me as a academic from Australia to fly in, extract data, fly out, publish that data, I get promoted, that's great. But it's actually at the expense of the people that are there. So a big priority for me is how do we support students, how do we support researchers in these contexts to do research? They have the solutions to their own problems better than we do. They know what's needed, they just don't have the opportunity. And I think there's a lot that we can do to actually support research happening in partnership, in tandem with colleagues that are living this experience day in, day out. I'll finish there. This is one of my favourite poems, Jack Gilbert. And it was something that sort of helped me get through when I was living in Bangladesh and sort of struggling with seeing what was happening there. And I think we've got some time, so if there's any questions, I'm very happy to take some. Thank you.
Great job, sir.
Thank you, man. Thank you. Thank you.
Another round of applause for Dr. Simon.
Thank you.
The amount of diversity with different groups across the truly remarkable. So at this time, we do have about 10 minutes for Q&A. Anyone who wants to step up to one of these two microphones to ask Dr. Simon about the work that he just presented on. Don't be shy. You know, we can have any types of questions regarding your work. Yeah, please come up. We already see some people standing up.
Thank you, man. Thank you. Yeah, sure.
My question for you is, do you incorporate a lot of positive verbal messaging to these kids as part of like that support pyramid you're talking about? The reason I ask is my business is coaching kids and providing physical activity for certain groups of kids, and I find that if we add positive verbal messaging to them about them and speaking value with each other, we get a lot of really, really solid connection with them. So it's like speaking positive value to these kids part of your program.
Yeah, great question. So look, I don't work directly with the kids. That's not my job. What I rely on is the local expertise, the local coaches, people like Salim, that picture of that coach in the camp during the football game. They know the community, they know the culture, they know the context. They're the ones with that expertise. My job is get the resources, put them together, work out the referral pathways. How can we support that to happen? So I think it sounds like absolutely, and I think what I've realised from the work we're doing with the Olympic Refuge Foundation, sports coaches are such an underutilised, powerful potential workforce, and that's what we're trying to capitalise on with that Ukraine work. So I think the expertise and the skills there that you're talking about, there's enormous potential. I can put you in touch with some of the coaches, and I'm sure they'd love to hear what you're doing. But that's not my area, but I think it's definitely part of what they're doing. Yeah.
Thank you so much. My question is, as we've learned from Japanese camps, where the gender roles were switched a bit, and also the feeling of hopelessness, loss of isolation of hope, being that they're going through genocide and being loss of culture, how much of the gender roles or suppression of or how men were feeling about losing the way to make the income, and all of that created a new culture, and maybe positive or negative. Did you see any of that, and how that played a role?
Yeah, thank you. So I think I'll just repeat for the people online, the question was about traditional gender roles. Absolutely, it plays out in camp. It's one of the reasons, and also in Australia, and my next talk I'm going to talk about how we translate this evidence in high-income countries. The gender role plays out particularly, one example I can think of is that we often hear women talking about guilt. If they take time to do something for themselves, like participate in exercise, when they have caring responsibilities, they have lots of other competing demands. And part of that comes for us, we've been thinking about that with community around physical activity literacy, and the idea about communicating messages about why this is actually critical for you in order to better care for your family. Because if you're healthier and you're active, less stressed, you're going to be a better caregiver anyway. So that's the way that we've worked with people to understand and sort of, I guess, not challenge, that's not the right word, but to look at maybe there's an alternative way of thinking about these interventions. And I think that's sort of the broader point, that we want to try to move away from this being of course, sport is great if people have time and if everything else is in line. But of course, it's never going to be in line. It's never going to be okay. So there's never going to be a better time than now. Yeah, does that sort of, Thank you. Thanks for the question.
Someone thanks me to talk. We don't know much. I'm not a researcher. I'm a practicing physician in Grand Rapids, in Michigan, where I don't know you're talking about this, we have a big Rohingya population. My practice actually serves some. And I promise I'll be answering my own question over the next few months, but would you have any takeaways for practicing for clinicians? How are we going to apply your research in your day-to-day practice?
Yeah, well, that's very, very cool. I didn't know there was a big Rohingya population here. We've got lots of resources I can give you, handouts, and there's YouTube links to videos we made in Rohingya language that you can take for sure. It's tricky. the group situation is so important. So the one-on-one sort of health advice we find just typically doesn't work. We've got to involve, and it's the same if you think about, and I'm sort of rambling here, but in a lot of communities, mental health is not an individual thing. If you ask people about their mental health, they'll say, well, why are you asking me those questions? Ask my brother, ask my mother, because actually they know the answer to those questions about me. So the community factor is critical, and thinking about if we're going to have health promotion interventions targeting these groups, they've got to be community focused. The next talk, I'm going to talk about those key criteria that we're using in places like Australia to work with these communities. I don't know if that's giving you an answer though. So I guess the advice would be, recognising culture. It's the most important thing for us, and we talk a lot about cultural sensitivity, cultural responsiveness. Things that we may not have even understood could be barriers, could be triggering. A really simple one in exercise spaces, we need women's only spaces and we need childcare. If we don't have those two things, that community can't come. So there's no point even trying. So yeah, I think it's probably just thinking about some of those structural barriers and how we might be able to overcome them. Yeah. Sorry, Matt, I don't know if that answers the question at all.
My name is Heather, and I am an MSW student. And I think as a product, perhaps, of my Americanness, but also as a product of being a Muslima, what you said today really resonated with me. I've worked a lot with immigrants, but that's distinct from working with refugees.
Yep.
And I'm intrigued by the last sentence of that quote up there, to make injustice the only measure of our attention,
Yep.
praise the devil. And if I have one major fault myself, I take things very seriously. I take my work very seriously. I take my studies very seriously. And recently I met a young woman who strikes me as she is fun, and she's playful,
Yep.
and she's also Muslim. And so as you're talking about getting cultural acceptance by working with the community, for example, in Bangladesh, and reaching out and saying, what do the women want? How do they
Yep.
want to incorporate movement? How is it going to be
Yep.
acceptable? What is the role of a sense of play in your work?
Beautiful question, thank you. Yeah, Heather, that's great. So the question for those online was about what is the role of play in these interventions. I can answer that a few ways. One, the Lego Foundation, so that's the Lego company. They do a lot of work in conflict settings. Their work is literally about what they call play. So there is a whole body of research and field about play-based activities. That's one of the things on that think tank that we brought together. So we've got the physiotherapists at one end talking about these sort of clinical exercise interventions. At the other end of the spectrum, we had people from the Lego Foundation talking about play. They're the same thing in many ways. For me, it comes down to the quality of the supervision, the environment that you're creating. Is that environment safe? Is it responsive? Does it meet the needs of the people? Whatever they want to do. Obviously, with the play, we would want to make sure that there's active play components. We don't want people sitting there playing on a screen necessarily. That's not exercise. So how do we focus on active play? And that's absolutely critical. I had that slide about joy, the joy in movement. It all relates. It's got to be fun, or else no one's going to do it. We've got a colleague of mine in Australia is doing this great work, so Dr. Oscar Lederman with the Pacifica community, so people from the Pacific Islands. And they came up with this 5F model, so it was fun, family, food, free. There's one more, but essentially it was those key things, and fun is absolutely critical. There's no point thinking about these clinical exercise interventions that just say you need to do this percentage of this and blah, 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 because for this group, what we're talking about is not going to work. I think you could argue for a lot of people it's not going to work. Yeah. Thanks, Heather.